Hi everyone, thanks so much for tuning into the Bloom Method's YouTube channel. I'm Brooke Cates, I'm the founder of the Bloom Method, and today we're gonna chat about questions. Lots of questions. What are safe exercises for the first 6 weeks postpartum? So at the Bloom Method, we make it really easy for you guys. I know I say that a lot, but it was part of what I wanted to make sure that we did when creating this method. Everything we teach our prenatal clients in regards to core exercises, you can safely do postnatally as you're healing and rehabbing your core, whether you have diastasis or whether you don't have diastasis, but we're still wanting to take the kind of slow road as we progress back into more challenging exercises. And the reason that is because in our prenatal core exercises, which we have tons of them, I think we put our mamas in more core exercises than they are ever prepared to be put into when they come into our classes, when they work with me or my trainers one-on-one. So don't worry about that. Our online studio will give you guys a plethora of core exercises to do during pregnancy. And in those exercises, we're always thinking about prevention of abdominal separation, prolapse, incontinence. So everything that we do or give you during pregnancy is going to be safe enough to do postnatally. One of our moms wants to know if it's ever too late to heal abdominal separation. And if you've had issues with abdominal separation in the past, should you be doing anything more or different for subsequent pregnancies? That's a great question. So no, it's never too late, ever. The linea alba doesn't regenerate and rebuild integrity super quickly. So it is really important for those of you who are pregnant now and want to be prepared. If you do have separation, we really advise healing it pretty quickly, starting to rebuild the foundation within the first week postpartum with those gentle breathing and core activation techniques. But you can still heal separation at any point in your life. I have worked with women as old as 65 years old and have helped them have a stronger core, get rid of back pain, and feel so much better in their bodies while healing separation. So it's never too late. It's just going to take more diligence and more dedication on your part because the muscles haven't been working the way that they need to work to close the separation. And there has been core dysfunction for maybe 3 to 10 to 15 years. So we've got to get the muscle fibers to start talking to one another and moving in a way along the body that's going to be really supportive in the healing process. And as far as what to do in subsequent pregnancies, I would say it's really about implementing not just smart exercises, not just learning how to breathe correctly and regulate intra-abdominal pressure, but there's this movement component. The way that we move every single day, laughing, coughing, sneezing, bowel movements, getting up and out of a chair, reclining on and off of the couch, getting out of the bathtub, getting out of bed. I could continue on and on and on, picking up your toddlers, picking up your babies, picking up the car seat. All of those things actually increase the pressure in your abdomen. So when we don't know how to regulate that pressure through a lifting of the pelvic floor, a wrapping of the core upon those movements, then it makes it really challenging to get the results we want, whether we're healing diastasis or trying to prevent it from getting worse from previous pregnancies. So several components should be addressed. Does your abdominal separation have to completely close to be considered healed? It does not. We talk, and we being the Bloom Method, and then also other colleagues in this industry with me, talk a lot about functional diastasis these days. Basically, once you get your separation down to about a finger, I've even seen it go to a finger and a half, but the separation is functional. So when you activate, you can activate the pelvic floor, the muscles come together to where the separation almost disappears, if not completely disappears. And then while you exercise and move throughout your day, you are able to completely functionally draw the two sides of the rectus closer together in all of these exercises, you can regulate the intra-abdominal pressure. That is going to be considered a functional diastasis. And people can have diastasis and do have diastasis, a lot of which they're not even addressing it because they don't know they have diastasis, and have a completely strong functional core. And if you're going for that washboard ab look, that happens too all the time, men and women. I see it in some of the strongest, most fit people. They have some form of separation, but you would never know it by the looks of their abs. I just know it because it's what I do for a living. So I see a lot of cores, a lot of dysfunction, and I help women heal in really big ways. So absolutely not. Functional diastasis is a thing. Any tips for correcting a prolapsed bladder postpartum? So prolapse is one of the things that I refer out to. There are things that I work with women on once they've seen a therapist, but it's kind of a blanket question, and I don't love to address prolapse in a very blanket statement because prolapse varies from woman to woman, and I just don't ever want to address it in a way that could potentially harm one person's prolapse and help another person's prolapse. So there are things that you don't want to do, like if you know you have prolapse and you haven't seen a specialist, you definitely don't want to be exercising high intensity. You don't want to be running. You want to be very minimal in your movements. Of course, rehabilitative core exercises, breathing correctly is always going to support any of that dysfunction that shows up in the body post-birth, but I would highly recommend going to see a specialist because prolapse is no joke, and we've really got to address it correctly and in the smartest ways possible depending on your degree of prolapse and your specific type of prolapse. So I'm sorry I can't elaborate on that question a little bit more. I definitely have thoughts when clients work with me one-on-one, but it's just not a question that I like to answer in a very broad way. Any tips? How do you know when your DR is healed, or enough so that going back to old activities, yoga, planks, won't re-damage or undo the healing? Again, self-checking the diastasis is great. If you still feel any separation between the rectus abdominis, checking the depth of the separation, that's going to tell you what the integrity of the linea alba is like. That's that connective tissue. That's going to give you a somewhat accurate of what your diastasis looks like or is like present day. Now, I don't love just checking diastasis once. I actually check diastasis twice. I check it with a non-activated core, and then I check it with an activated core so that we can figure out if the functionality is in the abdominal muscles. So I typically will tell women, you are fine to progress to planks, go back to crunches if that's what you want to do. I roll my eyes only because we don't teach crunches at the Bloom method just because I don't think they're super functional. We do teach head lifts, which a lot of women think are crunches, but it's actually a spin on a functional movement that mamas do, all humans do. But I'm not going to be one to tell you not to do crunches because almost every fitness class you will ever go to is going to do crunches, and I want you to feel like everyone else in the fitness class and be able to do what they do and what the instructor puts you through. Sit-ups, all of those things that women are typically scared to do post-birth. You can start reintroducing those into your exercise regimen. And again, it's a progression. We never go from rehabbing our abs to a full forearm plank or a tall plank. We start with a modified plank. At the Bloom method, we even start you with an exercise that we call bear raises. So there are ways to progress to make sure that once you get into the plank, once you re-implement the crunches and the sit-ups, you are doing them better than you've ever done them before. But you can start to do that as soon as you've learned how to connect correctly to the inner core unit, stay connected to the inner core unit throughout the core specific exercise, and really it all comes back to regulating that intra-abdominal pressure through your correct breath and correct activation. So yeah, we hope that when we launch the online studio, we really kind of start this wave of not being so scared to self-progress yourself, because when you can feel that you're getting stronger, when you have that self-empowerment of, I'm okay, I can try to put myself in a modified plank, and then there are ways that you can check in with yourself to make sure that modified plank is exactly where you need to be in that moment. We hope to give you a little bit more confidence in that area with the online studio, so stay tuned. What are some questions we should be asking our physicians at our 6-week postnatal checkup? How can we help them help us? Girlfriend, you are after my own heart. This is a huge passion of mine, is getting our medical community on board with specialists like myself. You can ask them a lot. I tell my moms to ask as many questions as you want. Here's the trick. Don't expect educated answers. I'm not saying that our medical professionals are not educated. They are incredible, and we are so lucky to have every single one of them. My issue is that oftentimes they are asked questions that they truly should be referring out to. And for some reason, they come up with this very broad spectrum answer, and it really doesn't support the individual. So ask them about your pelvic floor. Ask them about diastasis. At your 6-week checkup, ask them to check your diastasis. And if they don't know how to, ask them to refer you to someone. Basically, show up to your appointments time and time again, showing that you are determined to live your pregnancy and postpartum experience the best you know how. So the more questions you ask, the more serious they're gonna realize you are, and do not be okay with blanket statements. They are just not acceptable, and don't be afraid to reach out to specialists. I have a few of my favorite kind of global specialists. I love to refer, if the Bloom method doesn't really fit for people, I love to refer to Sarah Haley Fitness. She's out in California. Erica Zeal of Knocked Up Fitness. I think she's in the Midwest somewhere. I used to think she was in Florida, but I feel like Sarah Haley told me she was somewhere else. But she's really wonderful. Wendy Powell, she's in the UK. She's the creator of the Mutu system. She's really, really lovely. Ginny Burrell of the Burrell Institute. She's also UK-based, amazing, amazing woman. So those are people that you could always reach out to that maybe you couldn't see in person. Just like if you don't live in Colorado and you can't do a Skype with us, maybe you can't see me or one of my instructors, but if you email us, you have to know that people like myself, Sarah Haley, Erica Zeal, Ginny Burrell, we are also passionate about what we do, that we are going to do the best to answer you guys in a timely manner and help you the best we can. So reach out to us if you don't get the answers that you want from your doctors, but ask as many questions as you want. Don't feel like any questions are off limits. This is your pregnancy, your birth, and you deserve to know everything that you want to know and that you feel in the dark about. Okay, so we're gonna wrap it up. I actually still have a page and a half of questions. As you can tell, I love to talk. I love to educate you guys. I love to really make sure that you are informed. So I don't answer these questions really quickly, and I also don't apologize for it, because you can fast forward through the YouTube if you don't want to hear all of my responses. But if you loved this video, we're gonna do another one. We're going to answer the rest of these questions. Make sure you like the video, subscribe to our YouTube page, because we have so many projects here at the Bloom Method that I really wanna know what people want. So if you want us to do more YouTube videos, if you want me to share more about the Bloom Method, my own pregnancy, everything that the Bloom Method is about on YouTube, please subscribe, have your friends subscribe, and make sure you give a big thumbs up to this video. And if you have other questions, comment down below, ask your questions. If I have to do 3 to 4 videos, we'll just keep doing videos to make sure that you guys are getting the answers that you need. Thanks so much. It's always a pleasure to be with you guys, whether in person or virtually these days.